Hello, I'm Dr. Alicia Reisner-Bowman, and today we have a webinar designed to help improve the oral health of individuals with special needs. In this webinar, we are going to discuss safe and effective ways to address behaviors that can make providing oral care difficult. These are some of the current affiliations that I have, and they contribute to my knowledge base for these modules. Much of the information in this module was developed in conjunction with the Office for Persons with Developmental Disabilities in New York State and their Special Care Dentistry Task Force I am a part of. This information was implemented as policy for the state residences and continues to be used throughout the state. More in-depth training is available through OPWDD than the overview that I'm providing here. Again, we want to thank the Dental Trade Alliance Foundation for the generous grant that has funded this project. And again, the standard disclosure that you've already seen, that I am not gaining anything financially from any of the products we're going to be discussing. So this webinar is part of a series of modules. Viewing the introductory module will help make this information much more useful to you. And for the MIPS module that you're about to view, it's very important that you view the behavior management module first. We will be referring back to that module, and you will need to have that information in order to appreciate this webinar. So, thank you. These are the learning objectives we have for this particular webinar. And you will find the questions at the end of the presentation for the continuing education. So, medical immobilization and protective stabilization is oftentimes necessary to provide safe and effective care. When other methods have failed, these techniques can often be utilized as a safe alternative to sedation or general anesthesia. While you may find that some staff are hesitant to use these modalities, or some professionals are not trained or comfortable utilizing these modalities, or some caregivers themselves may be a little uncomfortable at first, it is important to stress that these are safety measures being used to help improve the overall health and well-being of an individual. These are going to be used for a limited time while care is being provided. The time frame should be specified, and breaks are usually given after 20 or 30 minutes. Now, in the homes, you're caring for someone directly, you're talking about 2 minutes of making sure they're staying safe so that you can do a good job taking care of them. Sedation and general anesthesia do have risks. With individuals have compromised posturing or other airway risks, transporting and care can be extremely risky. So proper monitoring after drug administration may not be possible for staff or caregivers, making sedation kind of dangerous. So I once had a staff member, this kind of exemplifies what I was just saying. You know, I had a staff member question me why we didn't just sedate somebody rather than stabilize them. So when I asked her how long the trip here was, she stated it was about an hour and a half. And I asked what she would do if they had an emergency during the trip back, such as the airway being blocked. She said, well, we would just go to the nearest hospital. So I then asked, well, how many hospitals did you pass on the way here? And she didn't know. And I said, and how far are the hospitals from the highway? And she didn't know. Well, an airway problem, 6 minutes without oxygen to the brain, and you start to have brain damage. So if they had some kind of an airway emergency without having oxygen on board, that could be forced oxygen on board, they were risking the ability to be able to manage the emergency. So the half-life of most of these sedating drugs that people use is many hours, not just a few minutes. And the majority of deaths in dental offices or other offices occur during sedation or general anesthesia. You're obviously not going to sedate somebody every time that you need to clean their teeth at home. So understanding how you might incorporate some of these these into your care plan at home is very useful when some of the behaviors are preventing you from doing the job that you need to do when you're caring for somebody. For somebody being cared for, controlling your movements or actions for 2 minutes is simply to provide better health for you and to keep you and others safe during the care process. Hopefully, as you get more comfortable with oral care, these measures will become less necessary, and these modalities can be very important when other alternatives fail. Remember, these are gentle holds of short duration. Proper training is the key. Ask your professionals how to properly stabilize someone for oral care. It's extremely important to avoid injury and to make the stabilization successful. Discuss the techniques being used and how to use it. Ask to provide the technique yourself and receive feedback to correct anything before you leave the office so you're best prepared to utilize the technique at home. Full body immobilization is very often what people think of when we talk about medical immobilization and protective stabilization, or MIPS as I've been referring to it, the quote unquote papoose board. Well, immobilization and stabilization can take many forms and can be used many ways to help make the healthcare plan more effective. 20 to 30 minutes of being snug as a bug in a rug is oftentimes a lot safer than having several people trying to hold somebody down. And many individuals with autism find this wrapping to be very comfortable. They may also already be using a similar technique for calming at home or at school. And very often, a weighted blanket can also provide the same relaxation that they feel when they're wrapped. And the papoose here on the left is from the Specialized Care Company, and you can see the netting breathes. You've got it attached to a papoose board, or in this particular case, we just needed to keep her from reaching and stuff. She didn't try to roll off. Here we are at home, wrapped in a blanket, 2 minutes of brushing, unwrap. Sort of like when you used to swaddle a baby. So the rules and regulations regarding who can provide informed consent change frequently. So once an individual turns 18 years old, you may no longer be considered the legal guardian despite being the parent. So check out the laws in your state and establish legal guardianship before the important 18th birthday to avoid any issues when seeking professional care. Have a legal guardian create a letter, preferably one that has been witnessed or notarized. Notarized. Well-intentioned helpers may bring somebody to the appointments, but this could create a legal mess if the guardian did not want that person to be seen at that facility on that day. So make it clear when you visit professional offices if you are able to provide consent for yourself. Many professionals do not understand that various learning abilities and levels of consent. Some think having a power of attorney means that the person is the only one who can provide consent, which obviously isn't true. I have a power of attorney with my husband and vice versa, so that if anything ever happened to us, we know we would be able to answer for each other. And also, since I'm in town, he can make decisions for me and I can make decisions for him. So just make sure that you do bring the necessary paperwork to any of your initial visits, and also have it available for the professional staff so they can copy it into the record to help avoid confusion. If you need to provide that information ahead of time, like we discussed with the medical, it makes it easier so all the I's are dotted and the T's are crossed, so you don't waste a lot of time at the initial appointment trying to figure out if everything's in order. In deciding what modalities we should use, remember we start with the simplest techniques first. As a person becomes more accepting of care, the need for MIPS will also reduce over time. So trying other less restrictive techniques at each visit before utilizing a more restrictive technique is important. For example, a person who requires a papoose for extraction does not require a papoose for a cleaning. I had a patient who only required elbow stabilizers during the injections because they would reach for the syringe, and they knew it. They even asked me, "Do you have anything to keep me from reaching up when you have to give me the shot?" Because that's the only thing I'm afraid I'm going to reach up and then someone's going to get hurt. But after the injections, he was perfectly cooperative, able to care, no problems, and we would take them off. So mixing different behavior management techniques is very common, and many of the things discussed in the non-pharmacologic behavior management webinar should be utilized along with these techniques. Never allow anyone to present these modalities as a punishment for bad behavior. These techniques are necessary to overcome behaviors from fear and anxiety and oftentimes physical limitations. Always stress safety, safety, safety. Use terms like help you be able to be a good helper or help keep you safe and keep others safe from whatever the bad behavior is, like, or I shouldn't say bad behavior, the resistant behavior is, such as reaching or scooching or pushing. Always reinforce that you know they're trying to be a good helper, but they need some extra assistance for the task, whether you believe they're trying to help or not. But in many cases, that resistance comes from a history of negative experiences. So providing some positive experiences, even if we have to start out by, keeping the hands down or whatever we need to do, they will become less resistant with more positive experience. Keep in mind that restraining someone is not necessarily a bad thing. We wouldn't hesitate to keep someone still while providing medication. So we shouldn't hesitate to keep someone still for 2 minutes while providing proper health care. This idea takes us back to our discussion of supervised neglect that we had during the introduction. How many times can someone be allowed to push you away, record that as, oh, didn't want to get their teeth brushed, before it becomes a critical concern that we're neglecting their overall health? Drugs are medications. And some people will self-medicate for procedures, and this can cause complications with care, even if the medication is something that's prescribed by a physician first. Proper behavior assessment should be done by each provider before any management techniques are used. Cooperation levels are going to be different for different environments with different people. So it is important to communicate with professionals before initial appointments that you are used to administering a medication as part of a regular protocol. Clarify whether or not they have the proper permits or licenses to have somebody in their office medicated. There's a general belief that if the medication was prescribed by their doctor, then there's no problem for the dentist if the patient is sedated, which is not true. Every state has different rules. Professionals need to consult with the guardians, the physicians, psychologists, staff. Oftentimes they have a million people they have to talk to before they can even do a proper behavior assessment. I can't tell you how many times somebody said to me, "You're not going to be able to get anything done. She always has to be sedated." And, or, mom says you're not going to be able to get anything done. Well, my first thought is, oh yeah? Let me show you. And we could manage sometimes to get the exam, a cleaning, and x-rays just by using some simple techniques. And then I'd always say too, let mom know how well the visit went. So don't reinforce history before a visit. This might only encourage a repeat difficult or uncooperative behavior. Instead, stress how happy you are to be seeing this professional and how you know they'll be able to help. And the same in the home environment. If you had a bad morning or you had a bad day the day before, don't dwell on, well, we're going to do better than yesterday, right? Dwell on, yesterday you were really good about staying in one spot. Maybe they gave you some other problem, but you were really good about staying in one spot. So I'm really glad you were able to do that. And today I know we're going to get even further. Be a cheerleader. Keep in mind that restraining someone also is dependent upon what you're doing, okay? If you see here, for the purposes of something that's considered routine or to protect somebody, it's not necessarily be considered a restraint. So seatbelts are a great way to help people feel safe, that they're not going to fall off the table or on your chair, in addition to helping keep a fidgeter in place. I have a patient with cerebral palsy who was adamant about not getting in the dental chair, and her speech was limited, so it was very hard to understand her. And I asked her why she didn't want to get in the chair, and we finally understood that the word she was saying was fall. She was afraid she would fall out of the dental chair, so she didn't want to leave her wheelchair where she felt very secure. So when we offered to use a seat belt so she couldn't fall, she immediately was very expressive and said, yes, yes, that would be fine. And when we got her transferred and we gave her a seat belt, she was happy as can be. I've also had patients who got used to using a seat belt ask, where's my seat belt? And reach around to put it on themselves. They like having that security. And with little kids, telling them that they're going to go for a ride up and down in the chair, or you need them to stay still while they're playing at the table with something, a seatbelt is a wonderful answer, because they'll usually say, oh, if we're going to go for a ride, yeah, they have to wear a seatbelt, right? They're used to doing that in the car. So usually the answer is going to be yes, because they're used to wearing it when they go for a ride. So now you have a seatbelt in place, you have them go up and down, and they're also staying put. If you're used to using the seatbelt for transportation, wheelchairs, or any other safety or comfort reason, let the professionals know and bring a seatbelt along, even if it's just a long belt that you can fasten like you do for everything else. Many offices may not be equipped to provide a quote unquote seatbelt. Many people are afraid of providing oral care when they think someone may bite them. People with uncontrollable spasticity are often reluctant to be cared for themselves because they don't want to bite somebody. Asking if it's okay to use a prop will sometimes help you know that no one is going to be hurt. A prop helps to make things a lot easier. It allows somebody to rest on something rather than strain to keep their jaw open during care, which will also ease the discomfort in the joint, as well as making it easier to see into the mouth. They're great for someone who has trouble keeping their mouth open, biting on the toothbrush, squeezing their lips, etc. Ask to be shown the proper use of a mouth prop and how to buy or make one for yourself. Providers get so used to using them that we very often forget to teach you how to use them. Having something on one side propping the mouth open lets you take care of the other side. Think about whether you already have items that can be used as a prop. I had a patient who had a plastic rod that he would hold between his teeth and tap with another rod. And the staff kept trying to take it away from him. And I said, no, no, leave it there. It's perfect. I'll just move it around and then I can clean, around it, which made it much easier than trying to struggle with him because he didn't have it. And at one point, I think we used impression putty to cover the end of the rod so that he wasn't going to damage his teeth biting the rod. And keep in mind, too, those people that tend to bite the toothbrush, you can use the toothbrush as a mouth prop. Put one big brush on one side and then use the other brush, your normal brush, to clean the teeth. Ask to place and hold the prop while providing care so that you can leave the office and make sure that you're doing it properly. Sometimes an individual can hold their own prop in place and allow the caregiver to work around it, and sorting this out at the office is much easier than trying to sort it out when you're home alone. If a person that usually provides care isn't available, ask if they can come to an appointment so you can work together on mastering this technique. Office support staff, therapists, nurses, and other professionals that are already helping with your individual for home care can also work with you. And training a care person from a facility can be really useful as well, so that when you have a prop and instructions that go home back with the prop, that Who's been trained can make sure the person caring for you or a loved one knows how to use the prop and keep track of it in the oral plan. Now, I sometimes refer to this as fish hooking, where you use a finger and you have that finger get between the cheek and the teeth. You want to slide in and then you bring the cheek around. You actually want the person closing a little bit to make this looser to get that toothbrush all the way in the back. But you can also, if you're not, don't want to use the finger, you're afraid that you might get bit or slip, then you can use a mouth prop in the same way. Or, like here, I just have a tongue depressor sliding in there and pushing the cheek out of the way. So then he can bite down and I can get that toothbrush way in the back, right by the gums where I need to be. Items used for office visits can be requested or ordered for use at home. So staff nurses, physicians, behaviorists, and psychiatrists might be necessary in order to get these modalities implemented into a daily care plan. But once it's in the plan, the frequency of use, the time of the intervention, how successful was the task when the intervention was applied should all be documented. And ask for a sheet to help keep track of things. Ask the physician or the provider that gets you the modalities to create a little tracking sheet. So not only will the information be there for you to keep track at home of how successful you are, but it will also be helpful at return visits to show how successful you've been with all the different recommendations that you've received. And as we said in the behavior management module, remember, don't introduce everything at once, one thing at a time. In the dental office, we usually have a patient reclined and we sit somewhere between 9 and 12 o'clock behind their head and we swivel around. But most caregivers kind of try to come at somebody from the front while that person is standing, which makes it nearly impossible to see what you're doing, okay? So many times you need to be behind the person that you're caring for with their head in front of you so that when you look down, you can see into the mouth. If you've been in front of the person, be sure that you are at the same level or perhaps even lower so that you can see up into the mouth. And if possible, have them tip their head back and support their head with your hand or a pillow or a towel or something similar in order to keep their head from bobbing around as you're trying to get in there and brush the teeth. Bean bags can work really well for this also. A nice big bean bag that you can lay them in and brush their teeth. Now you may say, well, what are we supposed to do in the living room? They can always spit in a cup. They don't have to be at the sink. As dentists, it's not unusual for us to hold someone's head in order to provide care. Most caregivers really don't understand how to do this properly. Ask for help for doing this so that you can feel comfortable and be able to provide better oral care and be better able to assist with this. Trying to hit a quote unquote moving target can be dangerous. Keeping the head still simply makes it easier for everyone to be able to provide care and helps to lower the overall anxiety and fear associated with oral care. The purpose is to prevent sudden movement. Pressure should be equal and opposite to the individual's movements. So I often tell people that we're going to put our hands here to remind you to keep your head in one spot. If you start to move, we'll try to stop you so you can stay safe. We're right here to help you if you need us to, but reinforce that you're keeping them safe, and it makes it seem as though you're correcting something that they're really trying hard to be helpful with and that they just might need a little extra help. This is true for hand holding as well. And don't hesitate to ask somebody to stabilize your head if you think it will help. I've had people with nervous disorder have a slight shake in their head and they say, is that going to be a problem? And I say, well, no, I'm just going to hold your head still while I'm working. And they said, oh, thank goodness. I was so worried you wouldn't be able to take care of me because my head shakes. So you also have to keep in mind too that you want to let them know it's okay. Many people will not offer because they're afraid you may consider it abuse. So speak up and let them know it's okay. So these positions, as you can see, not only do they make it difficult for a person to breathe, it also makes it difficult for you to see what you're doing. So don't be afraid to speak up if you see this happening during an office visit as well. Sometimes we get so involved with what we're doing that we don't notice that the head is shifted into a bad position, that the patient, when they're trying to be helpful, is looking up, looking up, looking up, and now they're is tilted back, and now it's harder for them to breathe, or it makes it feel like they can't swallow. And please offer to help if it appears as though there just aren't enough hands to get things done safely. You know, ask them, show me where you need me to put my hands so that I can help you get this done safely and more efficiently for my child, my husband, whoever. Yes, believe it or not, I have seen parents grab onto the hair of their child in order to keep them still. It's not a good idea. Whenever you're stabilizing the lower jaw, you need to be holding this part of the jaw right here. We call this the angle of the jaw where the bone is prominent. You don't ever want to hold under here and put pressure upwards. That pushes into the floor of the mouth, pushes into the tongue, and it not only feels like someone's choking, but it actually can choke them. So this would be correct if his hands were here on this part of the jaw, the bone itself, and not underneath. Never apply pressure onto a joint directly, okay? Now, elbow stabilizers are great for keeping hands from being able to reach. This can be helpful in many different settings, so if you find that they're successful in the office, consider their use for other professional visits as well. Ask if they can be ordered so you can have some for home use, or if you could borrow them to take to another provider's office. But contact the other provider first to make sure that it's okay to use them during the appointment. They may not be comfortable with you just showing up and using them. But usually, if this becomes a part of their regular care plan, so there's documentation of consent, then it's not a big issue. I even had a mother ask me once if she could borrow these to get her child through an eye examination. I called the ophthalmologist first to make sure they were fine with it, and then the parent took them to the appointment. They used them, and when they returned them, they said it was the first successful eye exam this 27-year-old had ever had. They were able to do the glaucoma test and everything else because he wasn't reaching and pushing at the equipment. Now, these knee stabilizers are also very helpful for those scoochers, the ones who will bend and start pushing themselves up the chair or pulling themselves down the chair or the bed or the whatever at home, right? So these are great because they keep them from being able to bend those knees and get those feet flat so they can start pushing their way around. The rainbow wrap papoose that I showed you earlier has the ability to only use the top portion to stabilize on top here. It's really useful for people who rock. And then I learned this technique about getting behind and pulling the arms around like this. I learned this from a staff person when I was with somebody who rocked, and they said, "Do you want to see how we feed him?" And I said, "Sure." And they got behind and did this, and I said, "Wow, if it's already approved for feeding, I should have no problem getting it approved for toothbrushing," which we did. and for all of his office visits as well. So it was really easy to get it implemented because they were all yet using it for feeding. And again, keep in mind, you know sometimes the best way to get something done. Don't hesitate to let the professionals know, this is what we do at home. Documentation goes not only for your office visits, but also for the care that you provide in an institutionalized or group setting. It's beneficial to keep track of this on a regular basis so that the plan that you make can be better improved upon over time. Whenever we introduce a technique like this, you want to make sure that you ask for a return visit early on so that you can discuss with the professional who showed you, how it's going, how you're doing it at home to reinforce that you're doing it properly, and to find out if you need to modify anything, and also to find out how successful it is. If you're finding that you're not being successful in providing the oral care, then something else needs to be tried. And you don't want to wait 6 months to have that conversation. You want to have that conversation within a month or two of executing a new plan at home. This billing code, some insurances will cover. They may require a narrative as to why it's necessary and usual insurance kind of stuff. So even if your insurance does not pay for this type of stabilization, believe me, it is worth every penny for the safety and the ease of care that it can provide during appointments. So this kind of is considered the cost of getting, specialized care. But always ask if there is going to be an extra charge and how much it is, and whether or not they know or think that it may be covered by insurance. You may find that you can submit it to your medical insurance and it does get covered, especially if the person you're caring for has a diagnosis such as autism or spasticity or quadriplegia, anything that may cause irregular problems. Remember, the point of these webinars is to show you how to improve the care you're providing to an individual with special needs. So don't hesitate to ask a professional to show you how to use these techniques, to get these techniques included in a plan and get those plans approved. The health of the individual is in your hands, and understanding the benefits of stabilization is up to you as well. As individuals, you certainly should ask about these techniques if you believe they'll help you. I've had individuals with spasticity ask me to have their legs stabilized or a seatbelt or a papoose, whatever they felt necessary in order to make things easier and more comfortable for them. Don't hesitate to ask. Don't hesitate to see. It may look scary at first, but when you try it, you may realize, I can completely relax now because I'm not going to suddenly reach out. I'm not going to suddenly whack at something. I'm not going to suddenly kick my leg. I'm not going to suddenly turn and fall over. So don't be hesitant to try something. If you don't like it, it can always be stopped. Again, I want to thank the Dental Trade Alliance Foundation and the Dental Lifeline Network for the grant that supported this presentation. Please contact me via email if you have any questions or concerns regarding this presentation. We hope you enjoy the remaining modules for your caregiving level, and thank you so much for participating. I want to acknowledge OPWDD and the Medical Immobilization and Protective Stabilization Protocol that we developed and is now being used throughout the state of New York.